Okay. Hi, I'm Kayla,
I'm Katie.
and we are students at the Virginia Western Dental Hygiene Clinic.
Right. And as dental hygienists, we examine patients for signs of oral diseases and health conditions such as gum disease and oral cancer. We provide preventive care, including oral hygiene or teeth cleaning, and we educate our patients and the community on the importance of oral health.
This is our presentation called Up in Smoke on the effects of tobacco on oral health. And we'll play this video.
We all know that smoking is bad, and with all the chemicals in tobacco products, it's no surprise why. Tobacco use is the leading cause of preventable deaths worldwide. And if you're a regular smoker or tobacco user, you may have dealt with a lot of concern from your friends or family about your habits. You might even be concerned yourself, but just find it hard to stop. No matter the case, it's important to understand the dangers of smoking. Right now, about 36.5 million people in the US smoke cigarettes, and more than 16 million Americans live with a smoking-related disease. Smoking is bad for your whole body, but in this video, we're just going to focus on why it's bad for your mouth. One of the things that makes smoking so bad for you is that it limits your body's ability to fight off infections. That means when bacteria enter your mouth like they normally do, they have an easier time of building up and causing problems. One of these problems they cause is gum disease. If you're a smoker, your risk of getting gum disease is twice that of a non-smoker. Gum disease starts when these bacteria get under your gums. If they stay long enough, they turn into a buildup called plaque. Over time, your gum disease will get worse and your gums can start pulling away from your teeth. This forms spaces in between your gums and your tooth, and this can become even more infected. This infection can spread to the bones that hold your teeth in place and could result in your teeth falling out. And if you try to get this treated, good luck, because smoking also delays your body's healing time. The good news is, if you manage to quit smoking, your risk of gum disease and oral health problems will go down. And the longer you quit, the better your results will be. Now, even if you are a smoker, you might have it better off than other smokers. Generally, the more you smoke and the longer you smoke, the greater your risk of getting gum disease. But gum disease is just one of the problems smoking causes in your mouth. You're also more likely to get oral cancer, and this is probably the most serious oral health issue you can get. According to the Oral Cancer Foundation, out of the 50,000 people who get diagnosed with oral cancer in the US every year, about 80% of them are smokers. So yeah, not smoking can make a huge difference. And if you are a smoker, be sure to let your dentist and doctor know so they can check for any signs and symptoms early on. Did you know that smoking can also stain your teeth? In fact, having yellow teeth is one of the signs of telling whether or not someone is a smoker. This is because the chemicals in tobacco can attach to the outer layer of your teeth and cause them to stain over time. And if your teeth get too stained, you might not be able to fix it, even with whitening procedures. Another thing that smoking can cause is bad breath. Smoking leaves a distinct smoker's breath, and there's really no way of hiding it. As you smoke, some of the cigarette particles stay in your mouth. And smoking also allows more bacteria to build up in your mouth. Those two things combined are bound to smell bad. Gross. Thank you for watching. If you liked the video, please hit the thumbs up button and subscribe to our channel so you don't miss our new dental.
As you saw in that video, smoking can have a lot of effects on your oral cavity and your teeth. And we're just going to go into a little bit of detail about what some of those things are. Smoking can cause bad breath and bone loss, which are pretty serious. As you can see in the bottom left, smoking causes tooth discoloration or staining. It can cause nicotine stomatitis, which is inflammation of the salivary gland openings on the roof of your mouth. And we see this in many of our patients in the clinic that smoke. And it can also lead to increased buildup of plaque and tartar on the teeth, as you can see on the bottom right photo. And that leads to inflammation and increased gum disease.
So some more effects of smoking on your mouth. There's an increased risk of leukoplakia, which is in this picture on the lower left shows as white patches inside the mouth, and this can be an early sign of oral cancer. There's an increased risk of developing gum disease, as they described in the video, which is a leading cause of tooth loss. And there's also a delayed healing process following tooth extraction, periodontal treatment, or oral surgery. So your chances of recovering from these procedures is much more difficult. And here are just a couple more things that can happen from smoking. Black hairy tongue is due to a buildup of bacteria on your tongue, which leads to a hair-like appearance. It can be very long. We can actually almost comb it with our instruments. And also median rhomboid glossitis is a fungal infection that can occur on your tongue. And smoking highly increases your risk of both of these.
Oral cancer is one of the most serious consequences from smoking, and smokers are at a 10 times greater risk for developing oral cancer. Signs and symptoms may be a sore or pain in the mouth that doesn't heal or go away, a lump, a white or red patch in the mouth or throat, trouble swallowing or chewing, or a thickening in the cheek, or a sore throat that doesn't go away.
Okay, so now we're going to do an activity. We are going to share a form with you where we're going to match the ingredients that can be found in cigarettes with some other places that they can commonly be found. Okay, so here is the worksheet. It's got the ingredients on the left that are commonly found in cigarettes, and on the right is places where it can be found otherwise. So we are going to give you guys about 5 minutes to go through this and try to match where you think that these ingredients are found, and then we'll go over it. So we are going to go over where these ingredients are found. So acetone can be found in nail polish remover. Acetic acid is an ingredient in hair dye. Ammonia is a common household cleaner. Arsenic is used in rat poisoning. Benzene is found in rubber cement and gasoline. Butane is used in lighter fluid. Cadmium is an active component in battery acid. Carbon monoxide is released in car exhaust fumes. DDT is found in insect repellent. Formaldehyde is used in embalming fluid. Hexamine is found in barbecue lighter fluid. Lead is used in batteries. Naphthalene is an ingredient in mothballs. Nitrobenzene is found in gasoline. Nitrous oxide is found in disinfectants. Methanol is a main component in rocket fuel. Nicotine is used as an insecticide. Tar is a material for paving roads. Toluene is used to manufacture paint, and vinyl chloride is used to make PVC. So these are definitely some very serious chemicals that are very toxic for your body that are found in cigarettes.
All right, that concludes our presentation of material. I hope that you all learned a lot. We're going to take a few minutes to take some questions, and then we're going to review with a quiz.
All right, so now we have got a little quiz to review for you. I will pull that up. It'll take about 5 minutes to go through this and answer the questions to the best of your ability, and then we will review the answers. All right, so now we are going to go over those answers. What is the leading cause of preventable deaths worldwide? The answer is tobacco use. True or false? Smoking largely affects the oral cavity, but only minimally affects the overall body. That is false. True or false? Smoking limits your body's ability to fight off infection due to the decreased blood circulation and therefore delays healing. Is true. True or false? Smokers are 2 times less likely to develop gum disease. That is false. What are some signs and symptoms of oral cancer? That is a sore or pain in the mouth that doesn't heal or go away, a lump, white or red patch in the mouth or throat, trouble swallowing or chewing, thickening in the cheek, and a sore throat that does not go away.
All right, number 6, name a few oral health issues that are associated with tobacco use. And you could have said oral cancer, nicotine stomatitis, black hairy tongue, medium rhomboid glossitis, delayed wound healing, dental staining, recession, or periodontal disease. Number 7, the chemicals nicotine and tar can attach to the outer layer of the teeth and cause what over time? And that is staining. Number 8, true or false? Smoking can cause a distinct odor causing consistent bad breath, which is a sign of periodontal disease or gum disease. And that answer is true. Number 9, the probability of periodontal disease is increased when using tobacco. Periodontal disease can be described as bone loss, inflamed or receding gums, bleeding gums, and it is usually associated with increased pocket depths. And number 10, what is the safest form of tobacco? And the correct answer is there's no safe form of tobacco.
Okay. So that concludes our presentation on tobacco and the effects that it has on your oral health.
Thank you all for giving us your attention today. We hope you learned a lot, and we've really enjoyed presenting this for you. And that's all we have. Thank you.
Thank you.